Hello! In this video, you'll learn how to use temporary restorative material to place flexible bite turbos during InBrace treatment. When the lower dentition collides with the upper anterior brackets, the collisions can be uncomfortable and lead to debonded brackets. To improve patient comfort and reduce bond failure, use bite turbos to disocclude the bite until occlusal interferences are resolved. One way to prevent collisions is to apply flexible bite turbos to the lingual surface of the upper anterior teeth. A light-cured, temporary restorative material, such as Telio, works well for temporary filling and building up the dental anatomy to disocclude the dentition. Consult the manufacturer's instructions for use with Telio. Light-cured, temporary restorative material has a unique property. It remains partially elastic after light curing. This provides a flexible contact point for the opposing dentition that's more comfortable for patients. And because this material only needs to cover a portion of the bracket, it can be fabricated small enough for minimal bite opening, which also improves patient comfort and acceptance. The first step for flexible bite turbo placement is identifying the location of the occlusal interferences. Consult the InBrace treatment instructions, which indicate the expected occlusal interferences at the fitting appointment. Flexible bite turbos are commonly placed as interior bite turbos on the upper ones or the upper twos when there are occlusal interferences due to a deep bite. If the patient has retroclined upper incisors, then the anterior flexible bite turbos are often placed on the upper threes. After identifying the location of the occlusal interferences, you're now ready to place a flexible bite turbo. Start by drying the tooth with a tooth dryer or air syringe. Next, apply a thin layer of primer, like Assure Plus, to the dried surface of the tooth in the incisal part of the bracket. Dry and cure it for 5 seconds. Next, dispense a 2 to 3 millimeter ball of temporary restorative material extraorally onto the tip of an explorer or the back of a microbrush, and place it on the incisal side of the bracket and the lingual surface of the tooth. Using a microbrush, adapt the material over the incisal part of the bracket and the lingual surface of the tooth to create the desired shape for the flexible bite turbo. Then light cure for 10 seconds. Check that the patient is comfortable in biting on the flexible bite turbo evenly, and if necessary, adjust the shape of the bite turbo with a burr. Here, we can see flexible bite turbos in place, preventing the patient from biting heavily on the InBrace brackets. It helps to reduce the bite force over other brackets when in occlusion. When it's time to remove the flexible bite turbo, it's quick and it's easy. It comes off in one piece and doesn't require a handpiece. When you're ready to remove the bite turbo, use a scaler and simply peel it away from the tooth. Now, let's talk about what can go wrong. A common mistake is to extend the flexible bite turbo too far and cover the intelligent programmed loop. This can interfere with tooth movement because the programmed smart wire relies on its shape memory to move teeth on autopilot to the planned position. So make sure the flexible bite turbo only covers the incisal portion of the bracket and the lingual surface of the tooth, not the intelligent programmed loop.